Hey everyone, I'm Dr. Kelly Rainey, pelvic floor physical therapist with EmergeOrtho-Triangle and Associates of the Triangle region. I would first like to say thank you to Carrie for inviting me to talk about pelvic floor physical therapy on her Thursday Talk series on Instagram. I'm excited to go through these questions. I get asked a lot of questions about pelvic floor physical therapy and what it all entails. The first question is, who would benefit from seeing a pelvic floor physical therapist? I'm biased. We'll say that everyone would benefit from seeing a pelvic floor physical therapist. Just like a bicep, we all have that pelvic floor musculature, but it's so important. We use it for all daily function of voiding. So we can control urine, we can control a bowel movement, and we can release to make sure that we completely empty our bowels and completely empty our urine. And we do that throughout the day. It's also for sexual function, sexual orgasm. It helps aid in that, as well as that release, that open up to make sure that we don't have pain with sexual function. And then stability. Our pelvic floor muscles sit like a bowl, and so when we contract those pelvic floor muscles, it helps to lock the pelvis and create that control and stable movement when we try to bend, lift, carry, especially carry little people. I always say you can't have a core if you don't have a floor. And so in terms of benefiting from that, a lot of patients would benefit just from understanding and knowing how to appropriately utilize those muscles. But it kind of goes into the next question, which was what types of conditions would benefit from seeing a pelvic floor physical therapist. We treat a wide array of conditions. So I'll say the most common ones, but note that it's not limited to just these. Stress urinary incontinence is probably the most common of what you hear about, especially during pregnancy and in that postpartum phase. That is any involuntary loss of urine with increased pressure or movement, getting from a sitting to standing, laughing, coughing, sneezing, jumping, running, walking. It can, any sort of movement or stress onto the body and we lose urine is considered stress urinary incontinence. Urge incontinence, so feeling like you have to urinate frequently, more often than we typically should, as well as that includes waking up at night. We shouldn't have to wake up at night to urinate. Pelvic pain, which is kind of a lot because we can have different diagnoses of pelvic pain, whether it's endometriosis, vulvodynia, vaginismus, dyspareunia, which is pain with insertion with sexual function, or even pain during any annual examinations. And so we assess those muscles to see what's going on and where that pain is originated. One of the questions was, is it painful? We don't want pelvic floor physical therapy. It should never be painful. We're just assessing to see where the pain is and then what are the appropriate exercises, tools, and techniques so that we can get that pain to zero, so that we have no pain. So always in that direction. But in addition, other diagnoses like coccydynia or coccyx pain, if we have a fall onto that tailbone, or even during labor and delivery, we can injure that tailbone. Diastasis recti, so separation of the rectus abdominal muscles, very common during pregnancy because of that expansion, and then postpartum, and how do we rehab that back. So those are a lot of, and then prolapse was the other one that we commonly see, tailoring that a little bit more towards the pregnant and the postpartum patient. So that prolapse of either the bladder, the rectum, or the uterus, and we can assess all of that in a PT evaluation, which goes to the next question of what does a pelvic floor PT appointment look like? It is always one-on-one with the pelvic floor physical therapist. It's typically 45 minutes to an hour long. So I always say to plan for that, especially with newborns. We do a full assessment externally, a take a look at your range of motion, your flexibility, your strength, sensation, abdominal wall, abdominal muscles. If you have a C-section, the C-section scar and how that's healing, as well as scar tissue techniques that we can add to a home program. It is an internal examination. Those pelvic floor muscles are internal. However, we can always assess them externally. So I tell women it is 100% their control during an evaluation on if they're comfortable with an internal exam. If we do an internal exam, I am assessing the superficial, so outside of the vulva, for scar tissue, if there's a laceration, a tear during that delivery, how well does the tissue move, any sensory changes, any redness, irritation, pain, some things that we assess that might not have been seen at your postpartum visit or prepartum visit that could be new, that we work in collaboration as a team with our OBGYNs, our urogyns, our urologists to assess and make sure that we're not missing anything, especially because that can happen between visits. And so with that internal exam, we're feeling it's a single finger gloved exam, no stirrups, no speculum. And usually to get to the pelvic floor muscles, it's between the first and the second knuckle, so it's not deep. And we're assessing, do those muscles contract? How well can they contract? How long can they contract for? They are endurance muscles, as well as how quickly can they contract, and how many repetitions can you do? Is there any pain internally? Are we feeling any muscle spasms, any muscle weakness on one side? Sometimes we can have that instability between muscles because they run like that bowl. We can have a tightening on one side and not so much on the other side, and that can kind of come in the form externally if we favor our right side versus our left side. And sometimes we feel more of that right pain, hip pain. It can feel deep, and so we're kind of assessing and going through the hip joint internally and feeling what those muscles are doing. This will help to guide us what types of exercises that we can give you for home. If you have a tight muscle, I'm not going to give you a Kegel or a pelvic floor contraction right away. I'm going to make sure that you can relax that muscle first appropriately before we go into strengthening that muscle. And I like to use the bicep example with my patients. If I have a shortened bicep and I do this, I'm not going to get much strength out of it. I have to be able to fully release it. And the hard thing with the pelvic floor muscles is they are internal, so you can't see them, but we can feel for them. And so sometimes that home program can also entail internal stretching and tactile feeling for that muscle, and how well can you contract it and how well can you relax it. And so that all kind of ties into that examination and what we're finding, as well as for that prolapse, again, kind of going back to that postpartum, just feeling if there's anything that's dropping, what grade that's at. So that can help us to know how we're making that progress for any future follow-up visits. And then the last one was, how do you know if you would benefit from pelvic floor PT, i.e. what level? Is it the first thing or the last thing to try? I always just say, a lot of times I get the referrals from my providers. However, it doesn't necessarily mean that you can't come see me first. A lot of times with insurances, they have direct access for PT unless you have Medicaid, Medicare, or TRICARE. We do require a referral. But it's typical when you go to that postpartum visit, anywhere between that 4 to 6 week mark, that your provider may refer you to pelvic floor physical therapy because you have that discussion on how you're feeling in that postpartum phase and if there's any issues that are arising, as well as in the pregnancy, as you're seeing your provider, depending on trimester, how often you're seeing that provider. pelvic floor PT might come up if you're having any urinary incontinence or urgency or pelvic pain into that pelvic floor region. So yeah, those are some great questions. I'm always happy to answer any questions. You can reach me through Carrie, and she can give you all of my contact information. I hope you guys have a great day. Bye.